Hi friends, with this we are going to have a series on modifiers. Modifiers are quite puzzling for both medical coders and medical billers. Sometimes I've seen people doing trial and errors. In fact, the first time they put one modifier, that gets denied. Then what the air caller does is he used to put another modifier and then that gets denied. He removes both of those initial modifiers and then assigns a new modifier. Again, it is denied. And finally, he sends a claim without a modifier, it gets paid. Sometimes the claim is being flipped to the coder, and the coder might also experiment. I've seen many people experimenting with modifiers without understanding the core concept of what a modifier is. Now, as the word suggests, modifier means something which changes, something which adjusts. But it shouldn't change the meaning of the procedure. We can define modifier as two character codes which alter or adjust a given clinical scenario without changing the meaning of the procedure or service. Well, in this video, I would highlight the general characters of modifiers, and we will deal in depth about the assignment of these modifiers. And also, I want to let you know that coders and billers often have a tussle as to who exactly is accountable for the assignment of these modifiers. You need to understand coders play a significant role in capturing the right modifiers, but there are certain modifiers which require the attention of medical billers. It is not always the accountability or the duty of coders to assign modifiers. Medical billers would also have to check the various supporting documents and ensure the appropriate modifiers are in place. Well, let's move on. As we see in the first slide, the modifiers are two character code sets with the alpha and the numeric characters. Sometimes a modifier is made up of purely alpha characters, or sometimes it is purely of numeric characters, or sometimes it could be of both. There are several examples that I can produce, but as of now, you can see in the slide here that we have modifier GA, which is actually assigned for a Medicare beneficiary when ABN is in place. Now let's see the numeric character 51, which is used for multiple procedures. And then you have an alphanumeric character as you have the alphabet E and the numeric character 3, which indicates the procedure that is being done on the right upper eyelid. As you see, the term modifier is a noun, and the verb form would be to modify, which literally means to adjust. Modifiers are used in claims to denote partial or minor changes. Generally, we can see that modifiers can be classified as pricing modifiers and informational modifiers. When it comes to the sequence of modifiers, we need to understand that the pricing modifiers need to be reported first and then followed by the informational modifiers. As you see from the word pricing, that this modifier can significantly influence the reimbursement or payment of the particular healthcare claim. So these modifiers need to be reported or sequenced first compared to those informational modifiers. The informational modifiers do not play a significant role in claim reimbursement, but it reflects the accurate picture of the clinical encounter. Based on service types that we have enough modifiers. Now let's go through some of those service types. Firstly, we have surgical modifiers like 51 and 52. These modifiers are used with the surgical CPT codes. Anesthesia coders would employ the usage of modifiers like AA, QZ. We need to know whether it is the anesthesiologist or whether it is a CRNA, which is the certified registered nurse anesthetist. According to the involvement of the anesthesiologist, the type of medical direction, or whether if it is medical supervision, the modifier differs. Next comes the anatomic site modifiers, which are quite informational about the service that's being done on a particular body part. We have your E1 and TA. E1 is used for procedures on the left upper eyelid, and TA is a modifier that we use it on the hallux, which is a great toe on the left. We also have several therapy modifiers. When such services are being rendered by qualified physical therapists and occupational therapists, we need to assign modifiers GO, GP. For telehealth services, we need to assign modifiers 95 or GT. GT would indicate the kind of communication between the physician and the patient and whether this telehealth service originates from a recommended originating site. There are also several global modifiers. We will talk about global package and the global surgical period in separate videos so that you can understand the entire concepts in a lucid way. To a fresher, it might be confusing, but please understand that modifiers need to be reported with the HCPCS codes, the Healthcare Common Procedure codes. We know CPT as Level 1 HCPCS, and we also have the Level 2 HIPEX. Modifiers are not reported with ICD-10-CM codes, but they are used for both Level 1 and Level 2 HCPCS codes. If we don't use the right modifier, then there is a possibility of claim being rejected or denied. If you think that you want to give the right payment for your healthcare provider, then you should certainly know the knowledge about modifiers. I would like to recollect my experience in a medical billing company where I was almost ready to leave office as my shift time was over, but then I was being called by the billing manager who was having her busy schedule call with a doctor in the United States. It seems like they had a confusion about the usage of modifiers, and when I had to intervene, the physician on the other side was inquiring as what would be the modifiers which I have to use as I'm a postgraduate and I provide counseling services and therapy services. Moreover, I also provide such therapy services to adolescents. I was taken aback as this question was a bolt out of the blue because as you all know, there are several modifiers that we are using in our day-to-day practices based on the variations and the deviations in the type of clinical services that are being rendered to patients. There can be circumstances which alter such procedures and we need to capture them. I was clueless and then I thought for a while. I just asked them, Doctor, was this not this particular modifier? Maybe I was saying like HA modifier, but then the doctor on the other side corrected me, isn't it an AH modifier? You wouldn't believe that we still have modifiers like HA and AH. As a physician is a postgraduate and does services to adolescents, we also have separate modifiers to report his services. It's like every day we keep learning a new thing whenever we come in contact with providers, our peers, whenever we just open our box, which is a medical record. As of now, this is what I want to convey. And all these modifiers mostly are given in our CPT books and in our HCPCS books. Sometimes different payers might also follow different modifiers. As per their clinical policies, they expect that certain modifiers need to be there on certain claims. We always need to be very clear and follow the payer policies and ensure such modifiers in place so that we can get the right reimbursement for our providers. As we have just kick-started the session of the series of modifiers, I'll be discussing more and more about these modifiers in our coming videos. So if you have any queries, please post your questions and your comments, and I'll see you in the next video. Thank you very much.